Dr. Christina Chester, and welcome again to our MCPS video series, Waymaking. If you're joining us for the first time in a while, you'll see that my name changed. And so as formerly Dr. Christina Connolly, I am now Dr. Christina Chester in newlywed bliss. So as we get going with today, so our goal is to help families make their way through many of the emotional challenges we are faced with today. I have with me today Ms. Katherine Oyson, school psychologist at Burning Tree, Lakewood, and Wood Acres Elementary Schools. Thank you for joining us today.
Thank you for having me, Dr. Chester.
All right, so today we are discussing how depression impacts students. So for our first question, can you share with our audience, what does it mean to be depressed? And how does depression impact students in our schools?
Okay, so depression is a feeling or condition that impacts your mood and your motivation to function. Most people experience depression at some point in their lives, either for short periods of time or consistently throughout their life. For our students at MCPS, it really has many factors to play in how the depression manifests and affects their everyday functioning.
All right, so with that, so then what are some of the symptoms of depression? So what are some of the things that we want to make sure that our students, family, and staff should be aware of? Like say if a student has a depression diagnosis.
So throughout the day, children can feel a variety or a mix of the following symptoms. They can feel intense feelings of sadness, emptiness, loneliness, irritability, frustration, or outbursts over little things. I kind of like to think of the phrase mad is sadness's bodyguard when talking about this one, that when you're feeling low, your defenses rise up. Loss of interest in activities. And I'm not talking about like outgrowing things per se. Like if a child has been into drawing forever, but they just don't have the energy or the motivation to do it anymore, that might be a sign. Changes in sleep or eating a lot more or less, sleeping a lot more or less can be signs that somebody is having a depressive episode. We have low energy. Simple tasks are very difficult, such as brushing your hair, brushing your teeth, even picking out clean clothes. Just simple everyday things can feel like an insurmountable task. Your anxiety is elevated. You tend to fixate on things that you've done wrong in the past, and it can be tiny things such as, oh, I forgot to lock the door. It can be very small. Difficulty processing information and your memory. It can also feel like you're moving in slow motion while the rest of the world's moving at 60 miles per hour. Unexplained symptoms such as stomach aches, headaches, aches all over the body, but there's no medical reason for these. These are usually caused by anxiety. And then frequent recurring thoughts of death, suicidal thoughts, suicidal attempts, or self-harm. In these cases, if students are experiencing these symptoms, reach out to the mental health professionals at your school, such as your social worker, your psychologist, your counselor. Even some administrators have been trained as mental health professionals, and they want to make sure that kids are safe.
I know. Thank you for that, because I mean, so many of those symptoms, I mean, when you think about it, like, especially for our families who may be wondering, well, is my child depressed? Because, you know, my child, like you brought the example of drawing, you know, my child is an excellent artist and loves to do this, has been doing this for a long time. And all of a sudden, just like that, they just stopped and like, they don't have interest in that. And they also don't have a new interest in anything else. And so, you know, that, you know, is a helpful, I think, tool to really try to engage some of our families to see, like, you know, when you start to see these changes in behaviors, what is it? Like, there may be something going on with them, you know, beyond just, you know, growing up or like developmental changes that occur. So, and that, you know, talking about the people that can help. And so then as we get into that, so we talked about some of the symptoms. So what are some of the types of treatment that can support students with depression?
So in schools, some students can become eligible for educational support, such as a 504 plan, which provides accommodations for some of these symptoms, such as the slow processing. You can have additional time, or you can take your tests in a much smaller space to reduce your anxiety. Some students that are greatly impacted to a significant degree might need specialized instruction with an individualized education program that provides them the support that they need to access the curriculum, just because their depression is just getting in the way of their learning. Another thing is medication, which is always a family decision, but it's always worth talking to healthcare providers to see if it's something that needs to be considered for your child to have healthy functioning every day. Therapy, can't stress therapy enough. It's amazing. There are many different kinds, such as creative arts therapy. There's play therapy for younger kids, cognitive behavioral therapy, or dialectal therapy. And all of these kind of target looking at the root of mental health and your well-being and giving you a safe space to express your emotions with trained professionals. Group therapy is another option, especially for older kids, where they can connect with others their age and understand, everybody's kind of going through this, or somebody's going through something very similar to you. So you feel less alone that way. And this one might sound a little cliche, Dr. Chester, but mindfulness and yoga. And the reason that this one's amazing is it gives you a sense of control over your body, especially when you feel your mind's out of control, your life's out of control. And it allows kids to learn how to regulate their bodily reactions so that we can start working on their emotional reactions and getting them help. It's also a great exercise when you have that low energy, because you can do it lying down, you can do it anywhere, and it really does help you feel more relaxed at the end of the day.
Oh, thank you for all of those suggestions. When we think about treatments, we really have to think about mind, body, and soul, and
Mm-hmm.
that it isn't just one thing, So it's not just, okay, you're depressed, that means you have to go on medication. I mean, look at all the
Mm-hmm.
different avenues and ways that you can go and get support for either yourself or for your child, student, whomever. Like, there are different options that are available to help, and
Mm-hmm.
especially want to highlight the point of, if you need support in school, that there are options like a 504 plan, like an IEP or individual education plan, or special education supports that are available for students, and that families and students can talk to the
Mm-hmm.
school in order to get that help. So my last question, so do you have any suggestions or feedback for families and students to help them stay resilient during this time?
So all I can do is express my personal experience. And what I find helpful when I'm lacking energy or motivation is a couple of things. So one, in my space, it tends to get messy when I'm stressed out. So one thing I do is I find at least one thing that I can clean that takes 1 minute, something very easy like making the bed or cleaning off the bedside table. And it just kind of freshens up my mind, and it gives me a clear place to think. Wearing my favorite outfits, and I'm wearing one today because I was feeling a little gloomy with the outside weather, and this one kind of reminds me of sunshine. And doing things even when I don't have the energy, such as going to a friend's house just to play on my phone or watch videos, because it makes me feel less alone and it lets me socialize with minimal energy, and I don't feel like there's a stressor. So those are kind of the things that I do when I'm feeling these type of emotions.
Oh, and thank you for that. I especially love that, you gotta go put on that fresh outfit that makes you feel good for the day. I don't know, having something on that I like makes me, like, hey, that pumps me up a little bit. So,
Mm-hmm. Mm-hmm.
I appreciate that suggestion for our
Yeah.
viewers. So Katherine, I want to thank you for your time being with us today. And as always, we want to thank our viewers for joining us for Waymaking. To send us additional questions and topics to discuss on the show, please visit the link on your screen. Also, please go to our YouTube playlist to find additional shows in our series. And please join us next time on MCPS Waymaking.